Please,
A very good
pardon us.
afternoon. Very good afternoon to all. I'll be speaking about how we would be managing brunescent and hard cataracts. I have no financial interests. And we all know that these cataracts are always a problem to us because.
It's not coming. It's not
It's not.
coming.
Yes.
Okay,
Now
sorry.
it's-
These mature cataracts and hard cataracts are always a problem because there is no red glow in these cases, and the nucleus is very bulky and it has a very supra-hard central core nucleus. And also on top of that, we can have fragile, distended anterior capsule, which could be very friable and associated zonular weakness, and sometimes some corticocapsular adhesions, which make it very difficult to rotate the lens. And if we do so with force, we can land up in big problems. These are stretch capsular bags. Fibrous are the nucleus is a very leathery, tenacious. It resists division, and we could, if not, we do not pay attention, we could land up in incisional burns and increase incidence of posterior capsular rupture and corneal decompensation in these cases. So a very important part is to have a good pre-op strategy. We need to have a good detailed slit lamp examination to examine the core nucleus, what kind of a nucleus you're going to have. So we need to see that they are well dilated, and a pre-operative NSH are mandatory because your surgical time is also going to be a little longer. And your viscoelastic has to be a good viscoelastic, which is a dispersive viscoelastic for reduction of this endothelial cell damage. And we could also do the soft shell technique. The capsular rexes should be done ideally under trypan staining, and using of the forceps is preferred because then you get a very good controlled CCC. And in this case, you really need to have a tailored CCC. It should not be a small CCC. It should be an adequate CCC, but then keep in view of the lens that you're going to implant. It should be in respect to that, not too big as well. This is usually the most crucial step in these cases, because sometimes also these some cases which have high lenticular pressure also have under them a very hard core of the endonucleus. So this case again was very a typical case where you can see that it is a hard nucleus and about grade 3. So you can do a very gentle capsular rexus all around. It should be adequate. I don't have to make too large capsular rexus in this case also. And the important issue here is that the moment we touch the capsule, it's very important to anticipate, because if it is a very thin, friable kind of a capsule, you be sure that there is going to be a lot of zonular weakness also that is going to come in with this. And this is a lens which has a milky cortex, and under that there is a lot of, the nucleus is very hard. So what we need to do is we need to just give a little pinch and remove the fluid and then continue with the rexes. Capsular staining has advantages because we can see the anterior capsule and the contrast, and it helps us in case we lose the leading edge of the rexus in these cases. And sometimes there are usually attached fibrosis of the anterior capsule also. So remember not to just target the center of the fibrotic plaque, but go around the fibrotic plaque. And you can always do a two-stage capsular rexus. I wonder if this is working. Okay. Video. In these conditions, it's very good to have a lot of viscoelastic over the cornea, and you don't have your assistant keep on putting fluid on the cornea and wetting it, because the patient also gets this little apprehension because they feel the fluid. And you need to position the eye in an optimized way so that you get a good red reflex, and use the proper viscoelastic, heavy viscoelastic, so that there is a proper there is no damage to your endothelium. Sometimes people do use chilled irrigating BSS, which also helps in these very hard cataracts. And throughout the procedure, what is very important is that you must have all your maneuvers should not have a force on the nucleus. These should always be a very gentle maneuvering, and a very gentle hydro procedure should be done, multi-quadrant corticocleaving, so that there is no too much of bulging of the capsule and falling, and you get the snap sign and a problem in the posterior capsule. The nucleus removal should have adequate energy, high energy should be used with a adequate aspiration flow and rate and vacuum, bevel down in the bag sculpting. And important part is that in these cases, um, you may have a different kind of a scenario in which you have the endonucleus, which is very, very bulky, and the periphery is not that hard, or you may have a very leathery hard cataract. So in cases of very leathery hard cataract, it's important that we do a very gentle circumferential disengagement or separation of these the nucleus, and this technique can actually be done for all the cases. Either you do a direct chop, vertical chop, or safer for the endothelium would be to do these circumferential disassembly. Don't go for the first piece, but try and separate out the endonucleus, which is the problem in these cases. And once you get this endonucleus, it'll just come out like a flower petal. So you keep opening up the nucleus without, trying to very vigorously separate it in case you have a very loose zonules as well. So very gently you can do that, and the moment you start getting the endonucleus, start taking it bit by bit, and what you will see is that you will be left with the petal, which is not that hard. Then that moment you can lower your parameters, come down, and you can start taking the outside of the petal as well. And very important part is that in these situations there is usually not much of a cortical matter, so you need to take your side port, give a little support, so that you don't take or damage the posterior capsule, and very gently take the last piece. That is the important part. And during the procedure, whenever required, please do put in more viscoelastic so that the endothelium is well protected, and do all your maneuvers in the iris plane or below in the capsular bag. The last piece is here I'm showing is very important. Again, just protect it with your hand piece and gently come and take this nucleus out. So these epinucleus and cortical removal also, especially if you have a fibrotic plaque, be very gentle. Don't tug on it because there may be a zonular weakness, and once you do that, you may have a problem there. And sometimes you're also having posterior capsular plaques. You can try and avoid too much of polishing, and what also helps is a little bit of a hydro maneuver, which can, it's called a hydro polishing, which will help, and this is much more gentler. So in conclusion, these are challenging cases and require experience and skill, and a good CCC, adequate size CCC is the first step and is a very important step. Stay alert for possible complications and ready with management. Minimize the phaco energy utilization with adequate endothelial protection. Thank you very much.